Hello, I'm Dr. Guillermo Valenzuela. I am reporting from ACR 2024 from Washington, D.C. Today I will be discussing quickly the concepts related to the poster L10, which relates to the neuroimmune modulation in adult patients with rheumatoid arthritis with bio-DMARD and targeted synthetic DMARDs, inadequate responses at 12 and 24 weeks using a Sham-Controlled double-blind. So you'll be surprised to know that this is not a therapeutic intervention with a traditional oral medication or a biologic medication, but this is using an implantable device that stimulates the vagus nerve. Of concern to many and interesting aspect of the science, as I will show you further. So the purpose was to evaluate essentially the safety and efficacy of an implantable device in the cervical vagus region. And patients would be subject to constant daily stimulation. The total cohort in this study was 242 patients that were randomized in a 1-to-1 ratio to a sham, which was essentially the device being turned off for the first 12 weeks, and then every patient coming onto the active arm after 12 weeks of treatment. So this double-blind assessment allowed to obtain information during the first 12 weeks, which were critical to understanding perhaps the signal that this therapeutic intervention could show. So the patients had to have a previous failure to at least one bio-DMARD or one targeted synthetic DMARD. There were secondary endpoints that were also as important as the primary, which was the ACR 20. And the secondary endpoints included the DAS28, MCID, HAC, and one important one that perhaps gave this study a value of objective assessment was the erosion progression score using a Randomized score. So that would work essentially as a control of the activity, and also the DAS remission was part of the secondary endpoints. After week 12, as I mentioned before, there was an active crossover. So every patient at week 12 received the neuromodulation by this device, which was surgically implanted in the vagus nerve of these patients. Just a word about the demographics. Patients were an average of 56 years of age, and 86% of these were females, and the average duration of disease was close to 12 years. In terms of the breakdown of previous exposure to therapies, it's interesting to know that the patients who received bio-DMARDs, 39% of them had failed one previous DMARD, about 22% 2 DMARDs, and 3 DMARDs, about 39% of them. 53% of these patients were seropositive, and the high sensitivity C-reactive protein was 8.2 milligrams per liter. So important now is the results. At week 12, we saw a statistically significant difference in the groups, in the active groups versus the sham groups. There was a 35% of the patients who achieved a ACR 20 versus a 24% in the sham group, which gave a p-value of 0.02. Now, it's even important to see that at week 24, 51% of the patients on the active group continued to show ACR 20s, and of which 53% of them were the ones who were previously in the sham group. So all the secondary exploratory endpoints also showed a tendency that correlated with the ACR scores. In other words, there was accomplishment of the goals of the secondary endpoints, such as one of the most important ones perhaps is at week 12 the CRP low disease activity DAS score. There's also the progression of the erosion through MRI was demonstrated, and the most important one, which you can all think about, is safety. regardless of the surgical nature of the procedure, it was a rather safe procedure. Serious adverse events were only 1.7%, and as we can imagine, the most common adverse event was a post-surgical transient hoarseness and related symptoms to the surgical procedure itself. There were no reported deaths, and as a conclusion, I think this is a very interesting and absolutely novel way to modulate rheumatoid arthritis by a non-traditional mechanism, which is not an oral agent or injectable agent or infusible agent as we are accustomed to see in our armamentarium. Is rather an implantable device with all the implications that it brings up. So perhaps the final word would be we are interested in knowing the long-term effects of these outcomes, and I hope to be able to report those findings in the next presentation. Thank you very much.